Dr. Todd Muncie with Muncie Family Chiropractic and Sports Health Center joins us this morning to continue a discussion on regenerative medicine, and now available at his practice. Good morning, Doc. How are you doing?
I'm doing well. How about you?
I am fantastic. Staying safe, staying well so far. But let's talk about regenerative medicine. Who is a candidate for this?
Well, you know what? Everybody's a candidate for this. We look at the human body and it breaks down over time. And regenerative medicine is something that we can utilize now to help the body regenerate old, tired, worn out arthritic joints.
And let's talk about it. When you say regenerative medicine, what are you talking about? Talk about the specific treatments.
All right. Well, what we're talking about in regenerative medicine is basically stem cells. What we do understand in science is that each cellular structure is based upon a simple DNA sequence in a cell called a stem cell. And we can utilize these stem cells to inject into a particular joint or space, and it will start to regenerate that tissue that it comes into contact with.
And is this treatment very helpful? I know it's helpful for everyone, but it's particularly helpful with athletes, isn't it?
Oh, absolutely. We're getting ready to get into the big, season of sports again, and that's something that a lot of athletes are looking at. Whenever they get injured or get some trauma that's holding them out, sometimes we can utilize stem cells to help them regenerate and heal faster. And that means it gives them more playing time. It gives them a little more longevity. It also can help them in the long run as they age after football, baseball, basketball, things like that, so that they don't spend a lifetime getting worse.
And let's talk about the other services that you offer there at your practice. Tell us about some of the things that are offered there in addition to what we've talked about.
Well, when it comes to stem cells, and we talk about stem cells, we talk about the degeneration of joints. Well, one of the things we know that causes degeneration of joints is being overweight. So we also have a diet program here, something to help people learn to eat correctly and lose weight. And it's designed without drugs and without surgeries and without real strict dieting, to be able to lose weight pretty quickly, about 20 to 25 pounds in 6 weeks without any drugs or any hormones.
And these days with the pandemic going on and everything, health is at the foremost of a lot of people's minds. What is the one thing that you tell people to do to stay more healthy? What can they come and see you about to be more healthy?
Well, we talk to people about that one thing, diet, because if we look at the media right now and the things that are being discussed, the people that are most vulnerable are people with hypertension or heart disease, obesity, and diabetes. That's your top three. Okay, we need to have this discussion when they come into our office. This is how we can help you. Teach you to eat right, exercise, get outside. Get outside is probably one of the most important things that we discuss with our patients, is because our immune systems, which is being affected by this virus and what people are worried about the most, has to come into contact with a lot of things out there so that it can start to learn. Our immune system learns every day. It develops each and every day and gets stronger by the things it comes into contact with. Being cooped up in a house and not getting out and not starting to get your body integrated back into the society and back into its normal functions actually weakens your immune system. We want people to get outside. Your immune system has to learn. It has to be, come into contact with different things, bacteria, viruses, things like that, to get stronger. So we recommend people get out. Now, we don't want people to rush out and jump into a big crowd right now. We want them to take their time, but we definitely want them to get moving again, because movement helps with diabetes. Movement helps your joints stay lubricated. So we help them get moving again. And by adjusting the spine, we're keeping that motion fluid.
And you're accepting new patients all the time, correct?
Absolutely, every day.
All right. Dr. Todd Muncie, thank you for taking some time with us today. Some wise words, some wisdom to pass along there, and getting us ready, getting us active, getting us back out there as the pandemic draws along here. We appreciate your advice today, sir.
All right. Thank you so much.
All right. Dr. Todd Muncie, we got information for you about his practice, regenerative medicine, chiropractic, sports health. It's all right there on the screen.